It's been more than a year into the pandemic, and every time Dr. Jamie Taweel comes on, I have a whole list of questions for him.
Oh, yeah.
I kind of feel like he's my personal doctor.
A little bit.
Hey, Dr. Taweel, how are you?
It's oh man, I don't know if I'm gonna get them all.
No. See, you're lucky this isn't in person because I'd be showing you my sprained ankle right now.
Uh-oh.
Oh, geez.
But I finally am breaking down and going to the doctor on Friday because I think it's more than a sprain.
Uh-oh.
But
Yeah, I looked at. I can't keep running on it.
right, I've added wine to my healing regimen, though.
Oh, boy. Oh, man.
So along with the ice, the rest, what is it, rice? Rest, ice, compression.
Elevation,
Yep.
and then wine.
Yes, exactly.
Silent W.
I've added that. Hey, good doctor. Good to have you with us. It's been a few weeks since we've talked to you, and sadly, we're seeing the numbers start to increase here in the state of Michigan.
Yeah, unfortunately, that's happening. I think people are getting a little too brash because they're getting the vaccines, and again, the vaccines prevent you from getting a severe type of COVID, but at the same time, you can still spread things. We're trying to get people more vaccinated and better, hopefully better off. But things are unfortunately they're creeping back up.
So what I'm hoping is that eventually, and I don't think this is the case just yet. You can correct me on this. Is that you're able to start getting the vaccine at your doctor's office through your primary care doctor, because I think people are comfortable with you. You have a relationship with your patients.
Well, yeah, I would like to hope I do. Every patient that I have has been asking me questions about the vaccine. They're asking me the really important questions. Is it a hoax? But they're asking me the real important questions. I have this type of disease, or I've taken this, or I have these types of allergies. Is it going to interfere with the vaccine? Excuse me. My advice is always going to be the same. If you go there, they have a very clear list of you can't get the vaccine if X, Y, and Z. So I would rather go and get turned away than to not go at all. You know what I mean? But doctors are starting to have them in their offices now. The vaccines are becoming a little bit more available. It's usually it's a issue of supply and demand. I know the big pharmacies are going to get them first, and they have been, and the hospitals certainly have them, and physicians that are affiliated with hospitals are certainly getting them easily. More of the private guys like myself having a little bit of a time getting them, but they're coming through. So hopefully everyone can get the vaccine soon enough.
To me, it's kind of like testing in the beginning, right? It was so hard in the beginning to get a test because of the delay, and it's a supply and demand, and it's got to keep the demand, or the supply has to catch up with the demand.
Absolutely. And it's such a buildup, and then all of a sudden you're trying to do a rollout, and it becomes rather chaotic.
So what are your thoughts on some of these home tests that are starting to come out now?
Tests are it's always good to have an idea. I mean, a test is it depends on how sensitive the test is, how specific it is, whether or not it's accurate. Unfortunately, a lot of the tests are going to be dependent on operator error. If someone's if I'm trying to do a swab where I'm going really, really far back into the nasal cavity, and they're wincing and we're going back, how guaranteed can you be that patients are going to be able to do this at home? So my usual thought is to just use the tests as kind of as a guideline. Definitely couple them with symptoms, but I don't know if they're going to be 100%. I wouldn't trust them completely.
I felt so bad. I was talking to a guy this past weekend who travels a lot for work, and every time he travels or goes into a facility, he has to get tested. He said he's been tested like 70-something times, and I'm just thinking like, oh, ouch. He's like, my nose is so
Hopefully
sore.
he's switching nostrils. I mean, geez,
Right.
that's a lot.
It's not a fun test to get, but people are oddly enough getting very used to it. No, I've not had a lot of people complain about it as much as I would other things. But more people complaining about the vaccine themselves than the testing.
Right. And how much of this for you as a doctor is about trying to discredit some of the information that's being spread across social media?
Man, that is tough. I get a lot of things thrown at me that are, either blatantly incorrect, or I would say misguided, or misinformation rather than, a complete lie. But there's things that do go out there, and I try my hardest to give them a little bit of education. There's, people are coming to me for answers. They're not really coming to me to argue. Patients always come to me and they go, should I get the vaccine? And my usual response is, well, you're asking the guy that sells vaccines whether or not you should get a vaccine. I mean, I'm going to push it. That's what my job is. That's what I do. But, if they have questions or concerns and they're coming to me for genuine answers, yeah, I'll definitely try to educate them as best I can.
So are you getting the question right now, because this was the topic of dinner at Easter, about the differences between Johnson & Johnson and the Pfizer and the Moderna, because so many people are still believing that the Pfizer and the Moderna is going to change your DNA?
No. Does not happen.
Right. My niece is a biology major. She's about to graduate from the U of M. She's like, I'm a biology major. I think I understand this a little bit more than the rest of you at the table.
I do agree. I mean, I don't like to sit there and try to act like I'm better than anybody. People are very smart these days and can get their own information. My only advice is to just do a little bit of background research. I mean, I am not allowed to push anything that isn't peer reviewed. It's been through the very rigorous review process that most studies go through. And that's why a lot of times when you ask me these questions on things that haven't been completely published yet, I always give you caveats. This has not been completely reviewed. This is just preliminary data. We can't hang our hat on this. But some people just really want answers, and they're willing to jump on data whether or not it's been verified. And so I really, there's also a bit of confirmation bias. Some people just want to find these things that they're looking for. You go to, it's a joke from a comedian, where they go to imright.com and they find anything they want that's going to verify what they say. And it's kind of true, and I definitely want people to have an open mind. I don't, you don't necessarily have to think everything that I think. I just want people and patients to think for themselves and just make very educated decisions using all the information, not just what they find to be more appealing to their personal guidelines,
So with that, I did read a recent study talking about the importance of vitamin D. And I know for my husband, his doctor he had a vitamin D deficiency even pre-COVID. So he's been taking supplements for quite some time now. But then it came out about the studies about the vitamin D deficiency. And one of the reasons they believe it has hit the Black and brown communities a little bit harder is because so many people of color have a vitamin D deficiency. So how important is it right now for us to really kind of look at that?
I think it's very important. I think vitamin D is extremely important along the vast spectrum of health. I think vitamin D is going to continue to be important. I test for it a lot on my patients. I've diagnosed a lot of vitamin D deficiencies. I do think that people should take vitamin D supplements and keep that vitamin D at a good level. There's a lot of ways vitamin D impacts the body, most importantly with bone health, et cetera. But more true to what you're asking me, they're finding a lot of studies that suggest that people that have COVID, that are infected with COVID, are having decreased levels of vitamin D. And they're also starting to find a little bit of correlation between severe COVID cases and the vitamin D deficiency. Now, just because they're finding that, and that people with severe COVID cases have vitamin D deficiency, I can't extrapolate that data to suggest, well, if you take vitamin D supplements, then you have a lower risk of getting COVID or getting a severe case of COVID, because they have not studied that specific question yet. They're in the process of doing that. There's some relatively prelim data that's coming out, and here comes my caveats. This hasn't been put through the rigor and the machine of medicine to try and determine whether or not the data is sufficient or they have enough numbers. But studies can suggest that, all right, these cases, common sense would think that if you have lower vitamin D levels in severe cases, perhaps supplementing it would reduce your risk of severe cases. Correlation has not been found, but it's been suggested, and certainly there's nothing wrong with taking a vitamin D supplement.
And with that, Dr. Jamie Taweel with us here on the MegaCast. He's an internal medicine specialist at Grand River Medical Associates. And with that, just for your overall general health, it's good to have vitamin D.
Oh yeah, vitamin D is found on vitamin D receptors have been found on a lot of things, specifically with a lot of the immune response, which is where the study with COVID comes into play. Vitamin D deficiency, vitamin D levels have been shown to be low in people with significant asthma, people with significant autoimmune diseases. People with vitamin D deficiencies can have muscle weakness, They can have issues with their bone and bone development. It impacts a lot of other systems. So it is pretty important in your overall health. It can lead to a lot of nonspecific symptoms as well as some pretty significant diseases if left unchecked.
So for the people that take like a one-a-day vitamin, is it enough for them? Is that enough of the vitamin D supplement, or should they take that in conjunction if they're doing a one-a-day?
If a one-a-day, I would assume has probably 1,000 international units of vitamin D, which is good for a maintenance dose, and I think that's appropriate. And definitely don't forget that sunlight exposure can definitely increase your vitamin D levels as well. It helps kind of catalyze the reaction that produces vitamin D in your body. But if you're deficient, 2,000 international units a day going up based on what your doctor sees is probably a good supplementation to try and get your levels a little bit higher.
It's going to be 80 degrees today. Get outside and get your vitamin D.
Exactly. I'm going to go walk my little puppy and get my vitamin D up.
Right? So we are kind of in the midst of allergy season as well. On top of COVID, the great thing is we did not see the flu cases this year that we would normally see. And I think a lot of that is, well, we're not seeing each other.
Very true. Yeah, flu cases have been down. I've said this before. I don't have any data to support this, but my thought process is twofold. Number one, people were social distancing and wearing masks. They're staying away from each other, and that's lowering your risk of getting anything, let alone the flu. And number two, the majority of the people that have flu-like symptoms weren't getting tested for flu, just in my opinion.
Yeah.
They were more or less going, do I have COVID? We say no. They go, okay, and then they go about their day, and they just assume it's something else. We weren't really doing a lot of direct flu testing. So
that is true, but the one thing though, trying to take these measures doesn't prevent us from getting our seasonal allergies though.
Yes, indeed. That seasonal allergies continue to be a mess.
And I'm trying to tell everyone, like I walked in here today and I forgot to take my allergy pill, and I was like, no, because you're sneezing, you're coughing, your eyes are watering, and I'm like, I do not have COVID, I have allergies.
Yeah, allergies can be a big mess, specifically in Michigan this time of year. I'm seeing quite a bit of it.
So with that, anything else out there that you want to touch on? Let people know before we say goodbye?
I think everyone's doing wonderful. I'm always positive. I think everyone's doing a great job. Yes, allergies are a big mess this year. Try to get them under control. Try to control the things in your ability to control. That's going to help you reduce your risk for getting severe COVID. Obviously, get the vaccine if you can as soon as possible. It's starting to open it up more. You can go to Michigan.gov or I think vaccinefinder.org. Will give you ideas of where they're distributing the vaccine. If you can try and get your hands on it, talk to your physician. I think it's going to be very important to get that so we can have ourselves a great summer and get some vitamin D in our systems.
Right. I'm so looking forward to that. But I will say the one thing, because I go on Vaccine Finder a lot or the Oakland County site, is what they're not doing is telling which vaccine is being available where. And I know that going forward, a lot of people, especially now, like you have kids, well, they can't get the Johnson & Johnson, right? They can't get the Moderna. They can only get the Pfizer. So how do you think that's going to work? Or is there a way, do you just call them up and say, hey, are you offering the Johnson & Johnson?
Absolutely. I mean, that's also going to be important for when you're getting your vaccine. Because if you get the Johnson & Johnson, it's a one-time shot versus if you were to do the Moderna or the Pfizer, you're going to have to go in for two appointments. So I think that you're going to need to know before ahead of time so that you're not, going out of town or doing something that's going to interfere with the second dose, because you have to be within a window for that. I think that you should be able to call these places. Once they start to open it a little bit more to kids, I think they'll be a little more specific.
Well, I'm not going to lie. I'm a Johnson & Johnson person. I'm a one and done.
There you go. It's a good vaccine, and that's likely the one I'm going to get in my office as soon as I can, just because it's easier to handle. It is one shot, and I don't require the deep freezer that's going to that a lot of people having a trouble getting to make sure that the vaccine remains stable.
And that is one of the other things too. Call me a cynic, but I've been a journalist for so many years, and I feel like the more people involved, the more hands that touch the product, there is that bigger chance that those security and those safety measures in place aren't going to be followed to a T. I mean, come on, we just had the Johnson & Johnson vaccine in Baltimore. The whole dose was mixed up, that and the AstraZeneca. So we can't trust the manufacturer, then we just know human error comes to play in. So
anytime you add more steps to an equation, there's more room for error. So absolutely, I think it can be a little bit maddening, but we're doing the best we can.
yeah. Plus, I'm a baby. I don't like needles.
Me way more than you, trust me.
Dr. Taweel, always great to have you with us. We appreciate your time.
Thank you so much for having me on. As always, I love being here, so I appreciate it very much.
Get outside and get your vitamin D. What kind of puppy do you have?
He's a rescue mutt. He's not a puppy. I've had him for 5 years, but I still call him a puppy because he's a little guy. So
Well, we call ours a puppy too, and she's a mutt, but we don't like to use the M word. So sometimes I'm like, when people say, "What kind of dog is that?" I'm like, "A one of a kind."
No, I like that. I like using that.
But
My dog is definitely one of a kind in how he can be a terror. I'm always trying to piece his backstory together because he just does odd things I can't even figure out.
So I had a friend who did a DNA test on his rescue dog, and it came back super mutt.
Super. My dog definitely. He's just something's not right with him. He's a little bit weird, but that's why I like him.
Right. We're all like that. Rescue dogs have their unique personalities. Let's just put it like that.
Ain't that the truth? But if he can tolerate my unique personality, I sure as heck need to tolerate his.
Dr. Taweel, always great having you. Thank you for your time.
Thank you so much. Have a great day, guys. Be well.